briefing gabung ya. Dapat briefing. Ya.
Hello, Dr. Sim.
Hello, hi everyone.
Welcome back again. Nice to meet you again in this class.
Nice to meet you.
Can we start this class now?
Yes.
Okay.
Hello, Faye. How are you?
Hello, Vinci. Good. How are you?
Good, thank you. How's everything?
Yeah, good.
Any difficulties in accessing Zoom at the moment?
Sorry?
Any difficulties in accessing Zoom again today?
No. All good.
All good. Great.
Actually, the event is quite smoothly run, so well done to you all.
Really well. In fact, it was planned, I think, a month before but
Yeah.
I know it's planned smoothly, I think. So everything goes well, I think. So
Yeah.
great if you really enjoy giving lecture for us.
Yeah. Yeah. I hope to see you all one day face to face if the situation allows.
We hope to invite you one day if the situation allows as well.
Okay. Thank you very much, Ms. Vinci and Dr. Sim. Can we start this class? Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Good morning, ladies and gentlemen. Before we start this class, I would like to introduce again our lecturer today, Dr. Tin Fei Sim. She is a senior lecturer and coordinator of International Engagement School of Pharmacy and Biomedical Science, Curtin University, Australia. She is also president of Pharmaceutical Society of Community Pharmacists and also pharmacy owner in Western Australia. Thank you very much, Dr. Sim, to see you again, and it's an honor to us to have you here. And before we this class, please on your camera until the end of the session. Now we are going to have a lecture and discussion with Dr. Sim in the topic of medication review and clinical intervention by pharmacists. Dr. Sim, time is yours.
Thank you. So I will just share my screen
Yes, please.
and share the presentation. Okay. Can I just check that you can see the screen? You can see my slides?
Yes, we can.
Yeah, thank you. Yeah. So hi, everyone. It's very nice to see you all again today. I'm assuming it's the same group as last week. Is it the same group of students from last week?
Yes.
Yes, yeah. So very nice to see you all. So I hope that last week you have found the presentation on immunization to be helpful. And what I'm hoping to share with you all today is a lecture on medication reviews and clinical interventions by pharmacists in Australia. So before I proceed, I always like to declare my position. So as introduced earlier at the start, I work for Curtin University in Australia, and I also do voluntary work for the Pharmaceutical Society of Australia in Western Australia, and also I practice as a community pharmacist, and I'm a pharmacy owner. So what I'm hoping to talk to you all today at the start is to give you an overview of pharmacy practice development in Australia. In particular, what has happened over the last few years, because there has been a change in the role of pharmacists in Australia over the last few years. I'm also hoping to give you some background information about how pharmacists are medicine experts and what does that mean, and to talk about some of the relevant advancements and initiatives in Australia and some of the roles of pharmacists in Australia, the different types of medication reviews and clinical interventions and the types of medicine-related problem. And at the end of this, we will give you an opportunity to ask questions, and I will try and answer, whatever questions that you have. Also, you would see that for today's lecture, because there are a lot of materials that I'm trying to cover, but because of the time frame, I would not be able to go into detail about every one of those services, but I'd like to just give you an overview so you know what services are available in Australia. And on those slides, I have given you references. So if you are interested to find out more about this particular type of service, you are very welcome to contact me, or you can go and click on the link that I've provided, and then you can find out more information. So first of all, I'd like to talk about the movement of pharmacy practice in Australia. So a long time ago, pharmacists used to be responsible for just selling and supplying medicines in Australia. But over the last 10 or so years, there have been movement from just selling medicines to now pharmacists providing patient-centered care. So patient-centered care and professional services would involve pharmacists to exercise their clinical judgment and to provide services to help this particular patient. So this is in addition to just selling medicines. I mentioned last week at my lecture that I grew up in Malaysia, and I know that in Malaysia, pharmacists still do a lot of selling and supplying, but in Australia, pharmacists still do that. But in addition to selling and supplying medicines, pharmacists are also there to provide professional services and patient-centered care. So later on, when I give you some examples of services, hopefully that will make a bit more sense to you what I meant by that. So what this slide is trying to say to you is that there have been a lot of changes in Australia in pharmacy practice over the last 10 years. So you are all in your final year of pharmacy degree, and you know that pharmacists are medicine experts. And in particular, in Australia, pharmacists are known to be medicine experts, and therefore their skills and expertise should be fully utilized. So no other health professionals know about medicine and how they work more than pharmacists. Even doctors are very good at making diagnosis, diagnosing someone with a condition and prescribing medicines. But when it comes to the medicine itself, what dose the patient should take this medicine, how often should they take it, does this medicine interact with another medicine, should this person use this medicine if they have liver problems, if they have kidney problems, how does this medicine work, exactly how does this medicine lower your blood pressure, exactly how does this medicine treat diabetes. Pharmacists are the ones that know the most in all of these things. Okay, so pharmacists are medicine experts, and therefore pharmacists should use their skills and expertise so that they can be fully utilized. So how is community pharmacy different to other retailers? So pharmacists are very different to someone who works at a shopping mall, or someone who works at a supermarket, for example, or somewhere that sells food or clothing or things. Why are we different? We are different because we are healthcare professionals, and that pharmacists are expected to do more than just normal retailers, which is a message I'm trying to send to all of you all in Indonesia as well, is you could be working in the community pharmacy, you could be selling or supplying a medicine, but you are different to other retailers. You're not just selling them, you're supposed to make sure that the medicine is safe and effective and appropriate for this particular person. And in particular, one of your lecturers, Vinci, who is online, Vinci's project, I don't know, Vinci, when you get back, you probably want to talk to them about what your project is about, but Vinci is working on an area very similar to this, which is to try and give some framework and improve the quality of pharmacy services in relation to minor ailments. But this is what I'm hoping all pharmacists, it doesn't matter where they are, in Australia, in Indonesia, in Malaysia, in Thailand, doesn't matter where they practice, pharmacists should be able to exercise their judgment. So how do we differentiate between a pharmacist and a salesperson? Pharmacists are not salesperson. Pharmacists have studied so much. So you've all done your degree, you've spent so many years studying. So of course there should be a difference between you and just someone who sells medicines. So what the difference is medicines are not just a normal item of commerce. So medicine is very different to a t-shirt, very different to a pen, if you're selling a pen and stationery. Medicines are very different to calculators, for example. They're very different because these things are items So these things are items, but medicines are not just items, because medicine has an impact on humans' health. It affects how we all are in terms of how healthy we are. It does different things to our body. So medicines are not just normal items. So every time when you sell a medicine, when you supply a medicine, you must make sure that it is safe and effective, and the most appropriate for that person. So I mentioned earlier that there's a lot of changes in pharmacy practice in Australia, and that is what we call the paradigm shift in pharmacy practice. So initially, you have what we call product-based supply only. And what we have seen in Australia is that pharmacists have moved away from just supplying products to now supplying products, but also sit down with the patient, or they can stand, doesn't matter sit or stand, but they have more conversation with someone to give them that service. And this includes counseling, telling them how to use the medicine. Is this medicine safe for you? Can you, what do you need to do when you take this medicine? Now, this slide here is about medicine safety report. So in Australia, we released in January 2019 a report here called Medicine Safety Take Care Report. So this medicine, if you are interested, I've given you the link here. So you can click on the link and read the document if you wanted to. And the document outlines why pharmacists are important to improve medicine safety. So to make sure that medicine is safe for people, pharmacists play a big role. So this is a really good document for you to have a read in your own time. This is also a really interesting document for you to read if you are interested to know about what the vision is for pharmacists in Australia when we reach 2023. And I've again given you a link here. You can click on the link and look at the full document. But it outlines how pharmacists play an important role in medication review and clinical interventions, and what does this mean for patients, for our profession, and for Australia's health system. So it's a really interesting document, and there might be very interesting information in there that you can extract and implement in Indonesia to help with Indonesian pharmacy practice. This is also another interesting document I want to share with you. Again, I've given you a link to this document here. It is called the Community Pharmacy 2025 Framework for Change document. So this is a document produced by the Pharmacy Guild of Australia in Australia, and it outlines what the vision is about community pharmacy practice when we reach 2025. So it has a lot of innovative ideas about what pharmacists will be doing over the next 5 years. And you can see here as well that you can see those images. And one of the images in this document is injection, someone like a little girl getting an injection. So that is obviously, like last week, we talked about how pharmacists are providing injections. And so same thing, this document outlines how pharmacists' role would evolve when we reach 2025, in which pharmacists are providing a lot of services, especially in relation to medicines.
Does it also include the extended services, maybe?
Yes, yeah, exactly. So it includes both enhanced and extended services. So enhanced services would be what is within the scope of practice of a pharmacist. But extended services are the things that pharmacists will need to do extra training for to qualify to do that service. So obviously immunization is one of them. Medication review is also the other one that I'll talk about later. But really good question. So to give you an idea about some of the career opportunities in Australia and the clinical roles of pharmacists in Australia. So pharmacists in Australia, you know, they can work in the community pharmacy and they are community pharmacists, or they can work in the hospital and they're hospital pharmacist, or some pharmacists would specialize in compounding. I'm not sure if you do compounding in Indonesia. Do you do compounding, Vinci, in Indonesia?
We do compounding in some prescriptions.
Yeah.
Pediatrics prescriptions. Yeah, we do compounding as well.
That's good. Yeah. So pharmacists in Australia can specialize in that. And also some pharmacists become accredited consultant pharmacists, whereby they get paid to do advanced or detailed medication reviews. There's industry pharmacists as well. So you could be working for a drug company, a pharmaceutical company, or you can be a GP pharmacist. So you're a pharmacist who work with a doctor, and the doctor would make the diagnosis, but pass on or hand the patient to you as the GP pharmacist to look at medication review. There is also aged care pharmacists, so pharmacists working in aged care facility, working with older people to help them with managing their medicines, and also drug information services pharmacist. So someone can ring up the drug information service and ask questions, and there will be a pharmacist on the line to answer their questions. There could be military pharmacists, academic pharmacists doing teaching and research, and pharmacists working with the government, looking at policy and administration, and advanced practice about specialization. And some pharmacists even specialize in diabetes and undertake further training to become credentialed diabetes educator. So they will talk to people specifically about their diabetes. And the list is growing. So we're seeing more and more clinical roles for pharmacists in Australia. So what about medication reviews specifically? So to give you an understanding, so medication review means that a pharmacist would sit down with a patient and go through all the medicines that they are taking and do a review to say, is this medication safe for them? Is there an interaction? Is there a contraindication? Is there a precaution? Is there a dose adjustment needed? Does this person need to be referred for monitoring of their liver function, of their kidney function? Is there a need to adjust the dose? Or is there a need to simply educate a patient, give them information about what is this medication for? How can you take this medicine? What do you need to be careful about? So all of these is considered as medication review. So when a pharmacist does medication review in the pharmacy, funded by the government to do this, when they're in the pharmacy, the current available services are meds check or diabetes meds check. Pharmacists can also go to a patient's home where they live and undertake medication review. And this is called home medicines review in Australia. Or pharmacists can go into a residential aged care facility, also known as nursing homes for the older people. And pharmacists can go into aged care facility and undertake medication review. And this is called Residential Medication Management Review, or RMMR in Australia. So this is just to give you an overview of the different terminologies of programs or services used in Australia. But pharmacists would do the same. Doesn't matter what the setting is. Is it in the pharmacy? Is it in patient's home? Or is it in a nursing home? They do the same thing in relation to medication review. So this slide here, this screenshot, I extracted this screenshot from the Pharmacy Program Administrator website. Again, I've given you the link on the bottom of this slide here if you want to find out more information about in-pharmacy medication review. So I mentioned earlier that there are two types of government-funded in-pharmacy medication review services in Australia. One is called Meds Check, the other one is Diabetes Meds Check. So it involves the provision of in-pharmacy one-on-one discussion and medication review provided by a pharmacist. And these services are aimed at addressing concerns or questions a person has about their medicine. So the way how it works is a patient comes into the pharmacy, have their prescription dispensed, and the pharmacist would say, okay, you are taking 5 or more medicine a day. There might be a bit of confusion about your medicine. Do you fully understand your medicines? And the patient might go, I'm not sure. And the pharmacist can sit down with the patient and go through every single one of their medicine and tell the patient, okay, this medicine is an antibiotic. It is used to treat your infection. This medicine is for your high blood pressure. It is there to lower your blood pressure, and you need to take one at nighttime. And you need to be careful about this and that. The next medicine, this is for your diabetes. This is how you take them. So that's what we meant by doing a meds check and diabetes meds check. So it is to help to address any concerns the patient might have and to make sure that they know how to take their medicines properly. And of course, if there was a medicine that is an overdose or an underdose, or if there was an interaction, then the pharmacist would talk to the patient and write a report to the doctor to make changes to their medicine. So this slide here, I have just given you, again, an extraction from the website. It gives you a definition of meds check and diabetes meds check. So I've talked about meds check earlier, but diabetes meds check is like a meds check, except it focuses on diabetes. So the service is provided to someone with diabetes. And the idea is to focus on their diabetes medicines and also talk to them about their monitoring device, their blood glucose monitoring device, and also how to actually reduce the risk of complications associated with diabetes. And with either services, each time before a pharmacist provides the service, they need to get consent from the patient, which means they need to ask the patient, are you happy to participate in this? And they would document their consent, and then they would talk to them about their medicines and contact the doctor if required, if there was a change in medicine required. This is a guideline produced by the Pharmaceutical Society of Australia, our peak national body for pharmacists in Australia. It provides a guideline for pharmacists providing meds check and diabetes meds check services. It is a really good document if you want to set up or implement a medication review service in Indonesia and you want to know how this is being done in Australia. This guideline is really good because it outlines the processes involved step by step. What do you need to do? What is involved? What are the considerations? And how can you conduct a meds check and diabetes meds check? So I've given you the link here as well to the full PDF document. You can have a look if you wanted to. Now, in this particular guideline that I shared with you, on page 5 in particular, there is a flowchart looking like this. It's the service overview flowchart. So it talks about how initially you identify if there was a need. Then you obtain consent from your patient, and then you undertake medication reconciliation or reconcile medicine. So what that means is you ask the patient thoroughly every medicine that they take, because you want to know everything that they're taking at the moment, including prescribed, over-the-counter, or complementary or herbal medicines or vitamins and supplements, because there might be some interactions with those medicines as well. So you would ask them about all of those medicines, and then you look at the medicines and produce a summary of this is everything that they're on. And then you give them counseling and you communicate with them and you make changes or recommendations if there was a need to change. And then you document them, you monitor, you follow up, and you send the report to a doctor. So now I want to talk about at-home medication review service. So at-home service would mean a pharmacist would go to a patient's home where they live and do a medication review, and this is called home medicines review. So the intent or the purpose of the home medication review process is to support or home medicines review program is to support the quality use of medicines and to assist to minimize adverse medicine events by helping people to better understand and manage their medicines through a medication review conducted by an accredited pharmacist in the patient's home. Whereas at the nursing home or at residential aged care facility, I mentioned earlier that this is called RMMR. So again, you are doing medication review, but this time it is at a nursing home. Another program that we also do in the nursing home or aged care facility for the older people is what we call the QUM service. So that stands for Quality Use of Medicines Program. And the purpose of the program is to support the delivery of services and activities by pharmacists, aiming to improve the quality, safe, and effective use of medicines within Australian government-funded aged care facility. So the pharmacist would go into the aged care facility and talk to the staff, talk to the nurses, talk to the carers, and educate them about how to properly use medicines. And they would help the nursing home to set up a protocol or policy and procedure to say, this is what you do if there was a medication error. This is what you do when there is a problem with someone's medicine. So it is a really good program. So the next thing I want to talk about is clinical intervention by pharmacists. So clinical intervention program is basically a formalization of the clinical role undertaken by pharmacists in a community setting. So the program is about improving patient health outcomes and improve quality use of medicines. Again, there is a guideline that is very, very useful for you all. I've given you the link here. If you want to find out more about how to undertake clinical intervention, the guideline is very good because it tells you exactly what you need to do to implement the service. This slide here, which is an extract from page number 8 of the guideline, talks about the steps undertaken for clinical intervention. So the first thing is if a pharmacist identified an MRP. So MRP stands for medicine-related problem. So what that means is if there was a problem with the medicine, it doesn't matter what it is. And later on, I'm going to talk about the different types of MRP. But to undertake clinical intervention, when the pharmacist identified a medication problem, the pharmacist would perform the types of medication problem can be summarized as using the acronym DOCUMENT. So document, D stands for drug selection, O stands for over or underdose, C stands for compliance, U stands for undertreated, M stands for monitoring, E stands for education or information, N stands for not classifiable, and T stands for toxicity or adverse reaction. So let's have a look at D. So D, which is the first column there, D is for drug selection. So this refers to all problems relating to the choice of medicine prescribed. So it could be duplication in the medication, which means if the patient is using 2 or more medicines that does the same thing. For example, if they are on a product that has paracetamol, and then separately they also take another product, a cold and flu product that also has paracetamol. And when you take them both together, there's a risk of overdose and duplication because they do the same thing. But patients might not know that they are the same thing because the brand names might be different, but the ingredients are very similar. So pharmacists would need to intervene. So drug selection also involves drug interaction when 2 medicines interact and should not be taken together. It might be a wrong drug for the condition. It might be an incorrect strength or inappropriate dosage form, or there might be a contraindication, or there might be no indication apparent. So there's no reason why the person needs to be on this medicine. Or overdose and underdose. The prescribed dose might be too high, or the dose might be too low, or they might be incorrect or unclear dosing instructions. Or it might be compliance. The patients might not be taking the medicine as prescribed, or the patient might be using too much of the medicine when they should only use once a day. Maybe they're using more than once a day, so there's overuse by the patient. Or there might be an intentional drug misuse by the patient, whereby the patient is over-reliant and misusing a particular medicine. For example, an opioid medicine like codeine or morphine, for example. Or it could be a condition that is undertreated. They might have asthma, they might not be using their inhaler regularly, or they might have high blood pressure and they're not using their medicines as prescribed. It also includes things like monitoring. How do pharmacists refer someone for lab monitoring and non-lab monitoring, such as asking someone to monitor their blood pressure, their blood glucose levels, their HbA1c, their INR, if they are on warfarin, things like that. It also includes things like educational information. So pharmacists will give education to someone. There might be also information around toxicity or adverse reaction that the pharmacist can tell someone about. So the outcome of the intervention can include a change in their therapy, or it can include referral by a pharmacist to another healthcare professional. And it could include provision of information to someone, whether it's verbal or written. It could be referring for monitoring, or it could be no recommendation necessary other than just educating the patient. So once again, I've given you the link there, and specifically pages 15 to 19 on the document. If you are interested to learn more about clinical interventions, I've given those are the pages that have all of those information. So this slide here, I wouldn't spend too much time on this. I've included this so you have it in your handout. It is a flow chart to how to undertake, again, clinical intervention and the different types of clinical intervention. So remember I said earlier that the types of clinical intervention forms the acronym document. And you can see here on the right-hand side of the slide, you have the document classification. So D is for drug selection, O is for over or underdose, C is for an issue with compliance, which means whether the patient takes the medicine or not. U is for under treatment, M is for monitoring, education, not classifiable, or toxicity and adverse drug reactions. Okay, so that's the end of this lecture. As I mentioned earlier, the purpose of this is just so that you get some understanding about the types of medication review and clinical interventions and the types of medicine-related problems. But if you are interested to learn more, if you look at the links, you will be able to find out more information. And I'm happy to take any questions at this stage.
Okay, thank you very much, Dr. Sim. Nice presentation. And now, student, you can raise hand to ask, or maybe you can write in the column chat. Any question? Okay, Dr. Sim, from your presentation, we know that there are many specific roles of pharmacists in Australia. Can pharmacists perform a multiple role, such as being a community pharmacy and also aged care pharmacist and academic and teacher and so on, or just one pharmacist just can perform one role?
A very good question. So a pharmacist can do more than one role, definitely. And we actually encourage pharmacists to do more than one role because it helps to bring in information across the different settings. So for example, I still work as a community pharmacist in my pharmacy, but I also am an academic pharmacist and I do research and teaching. So I can bring in what I learn in real life, what I experience in real life, and bring that into teaching to teach students and say, this is what I saw on the weekend practicing as a pharmacist. This patient came into the pharmacy and they were coughing, they were doing this, they were doing that, and I can tell them about what to do and bring in real life practice. And you would have pharmacists in Australia who are a diabetes educator, who specialize in diabetes, but also specialize in aged care. So they help older people as well. So definitely you can do more than one.
Okay, I think it can open mind, yeah, and for our
Yes.
students that pharmacists can have many roles to help patient. Okay, student, do you have any question to Dr. Sim?
So in terms of medication reviews conducted by pharmacists, right? Would you document it in a computerized system, so whenever patient come in again next time or the next time or maybe the next year, you would have their medication history and all of the things that pharmacists have done in just one file of that pharmacist. Is that also what happened in Australia?
This is a good question. So if it was a prescribed medicine, if there was a prescription for it, then it will be in the medication history. So in our dispensing computer software, it will be recorded there. But if someone comes in to buy something over the counter, like for cold and flu, they don't need a prescription for it, then it is not recorded in the pharmacy. But if it was a prescribed medicine for a chronic condition like high blood pressure, diabetes, mental health, asthma, COPD, any of these, it is recorded in the system. And right now in Australia, the Australian government has just implemented what we call the My Health Record electronic system, whereby it doesn't matter where the person is, they could go to different pharmacies, they could go to different prescribers, but they have one online profile, online on the internet. And if they give consent to a particular health professional, then the health professional can log in and look at the entire history of the patient. So that has only just started and it's still being implemented. But the idea is exactly, Vinci, like you say, one portal, one site for all the information about that person. Because imagine if someone has a heart attack or someone just collapsed on the road and someone brings them to a hospital. There might not be anyone around them to tell the hospital staff what medicine are they on, what medical history do they have, or what are they allergic to. They might be allergic to something. So how would the hospital staff know what to give them and what not to give them? So the idea of having that online system is that someone can log in and just check the history of that person. Yeah.
So does it mean that it will link also to the hospital, to whatever a patient can come to the hospital or maybe a community pharmacy or maybe to the aged care one goes. So does it mean that it will goes to there automatically with that?
Yes.
Wow.
Yes.
That's
so the idea
amazing system.
Yeah. So it's a standalone system, but the idea is that it doesn't matter where you work. If you're a pharmacist, a nurse, a doctor, you can log in and check the person's profile. But the patient needs to give consent to do that because it's their own private information. So for example, if you are my pharmacist and you want to know about my medication history, I need to go on my profile and give you access right. I need to give you consent. And then when you've got the consent and you've got the authority to go in, then you can see everything about myself. But every time when you go in, I will know that someone has gone in, just so that people can't, go and look up sensitive information about other people all the time.
Oh, I see. That's incredible. So whenever pharmacists make any clinical intervention, it will be documented in there, and people just need to ask
that is
here and there.
That is the idea. That is the idea. It has only just been implemented early this year, and COVID has speed up the process a bit. because there needs to be an online system, but it is still very new. So information is still being populated onto the system. Healthcare professionals are still trying to learn how to do this.
Maybe
next year it will be good.
Okay, Dr. Sim and Ms. Vinci.
Any questions from the student?
I think Anindita has a question in the chat room. So Anindita say, I want to ask, before the changes of pharmacies from only selling drugs to patient-centered care in Australia, did it mean doctors there prescribe and choose medication themselves? Yeah, so doctors still need to prescribe certain medicines, but certain medicines do not need prescriptions from the doctor. So it depends on what condition. So long time ago, almost everything you need to go to a doctor. And then the doctor will prescribe and the patient will come to the pharmacy and buy the medicine. But now, because pharmacists have this expanded role, there are more and more conditions that a patient doesn't need to go to a doctor. They will come to the pharmacy and the pharmacist would supply that. So it's like, for example, like minor ailments, for example, like certain medications where the condition is well controlled and stable. Pharmacists can manage that just over the counter now. Patients don't have to go to a doctor. But Vinci will probably give you a better idea because that's her project at the moment. She's looking at that. So Anindita also asked, that's fine. You can ask in the chat room. So for medication review services, when is pharmacists need to give the service? And what kind of patients? Is it the service only for severe cases? Very good question. So there are eligibility criteria. If you want the government to pay for it, there are eligibility criteria. So in Australia, for some of those services, the eligibility criteria is that the patient must be on 5 or more medicines. There must be, someone who lives at home, but the main criteria is they must be on 5 or more medicine. So it's not for everyone, it's for people who are more likely to experience medicine-related problems. So they are on 5 or more medicines, then the chances of them having a problem is higher. So therefore, they will qualify to get government-funded service. But if they just want the service, they just want medication review, and they don't need the government to pay for it, they pay for it themselves, then anyone can get the service from a pharmacist.
Okay, maybe Claudia, you can ask to Dr. Sim.
Good morning, Dr. Fai. In here, I want to ask to you, how can the Australian pharmacists change the paradigm of that in Indonesia? If this incompatible drug in prescribing from the doctor, we can change by self of the pharmacist. We must go confirm, and if the doctor not agree with this our complaint, we must still use that drug what the doctor prescribe. So how to change this paradigmanya ini gimana ubahnya gitu loh. How to change this paradigma. Thank you.
Yeah, so you're hoping this will change in Indonesia. Yeah, I can tell you in Australia, so the doctor might prescribe something, but ultimately the pharmacist, if you are the pharmacist and you dispense the medicine, you give it to the patient, and if there is a problem, if the patient suffers from side effects and go into the hospital, or the patient dies from that, the pharmacist is also responsible. So the doctor and the pharmacist are both responsible, because pharmacists are expected to practice autonomy. So autonomy meaning you have to use your own judgment. You can't blame it on the doctor. The doctor might prescribe, but if it was an overdose, you need to tell the doctor that it's an overdose and it needs to be safe. Whatever that you give out, it needs to be safe. So I know what you mean, because sometimes there might be a we call it coercion. So there might be a different hierarchy. You know, doctors are here, pharmacists are here, so we follow instructions. But at the end of the day, it's patients' lives, it's patients' health. So if you don't think this is the best thing, because you are the medicine expert, if you don't think this is the best thing for the patient, you need to raise that with the doctor and discuss this with the doctor and say, this is the evidence, this is the references, this is what I suggest, and discuss with the doctor. I know it will be difficult because that's also what we are struggling as well. But we always tell our students, you know, remember, everything you do is patient-centered. Your patient is in the center of your attention. Your patient's health and well-being is your priority, is your number one. Being scolded by the doctor is number 2 or 3. You can, that's later. But your patient's health and well-being is number 1. It's your focus. Everything that you do, it has an impact on your patient. Imagine if you are the patient, if you're not the pharmacist, you are the patient. Of course, you would expect your pharmacist to do the best for you. And pharmacists trust, public trust us to do that, and we must do that. It's a journey. I know it's easier said than done, but it's a journey. We know the end goal, but we need to keep reminding, and it's really a paradigm shift. And what we are doing in Australia is we are trying to change the culture amongst other health professionals as well. So we put doctors and pharmacists and nurses, for example, when they are in first year university, they study together. So they are friends. So they understand each other's role. So there's more respect. They understand each other's role more, so that down the track, when they're practicing, when there are problems, they can talk equal rather than doctors on top and pharmacists here. We want it to be equal. Patient is in the middle.
Okay, I think it is a challenge for us to shift the paradigm. And in the Department of Pharmacy, we have interprofessional education in curriculum to start this change. Maybe we hope that we can change this paradigm later. Okay, student. Okay, Hainun, please ask.
Thank you, Ms. Yuni. Thank you, Dr. Fei. I'm honored to attend this lecture. My name is Hainun. It was mentioned that there is specialization on pharmacist. I'd like to know more about this specialization role impact to clinical intervention. Are there significant role on this specialization to clinical intervention? Thank you.
Thank you. So, so you're talking about like specialization,
yes,
isn't it? Yeah. So what I meant by specialization is you can do clinical interventions in any setting, any types of medical condition, but some pharmacists would specialize in asthma. So they become an asthma educator and they are a pharmacist. So their clinical interventions focuses on asthma medicines and their puffers, their inhalers, their relievers, their preventer for asthma. You might have someone who specializes in diabetes and they specialize their intervention focuses on diabetes. You might have pharmacists who specialize in aged care, in older people medicine. You might have pharmacists specializing in cancer, for example. So they look at chemotherapy, cancer medicines, and interventions around cancer treatment. You might have pharmacists specializing in smoking cessation, pharmacists specializing in weight management to help people lose weight. So there are all these different areas of specialization. All pharmacists would need to know everything anyway, but the specialization means that they undertake further studies and they become credentialed to specialize in that area. So when there is a specialized need, when this person, let's say they have cancer, and they need a pharmacist who knows about cancer drugs, cancer medicines really well, then they would call these pharmacists who specialize in cancer medicine. So it is a growing area in Australia, but we are starting to see pharmacists specializing. So it's like doctors. So doctors would do a medical degree, But you have doctors who become heart specialists, the cardiologist. You have doctors who specialize in kidney function. They are the nephrologist. You have doctors who specialize in aged care, and they are geriatricians. You have doctors who specialize in like in eye, so they're the ophthalmologist, for example. So we are seeing the same, and we're encouraging the same in pharmacy, whereby pharmacists go into specialization as well.
Do they get paid separately, or they got funded, paid by the government, those specialized pharmacists, through any scheme of the Australian health insurance or something like that?
Yeah, it's variable, Vinci. It's like I say, it's something that is very new. The funding model is variable. Some roles we already have government funding, some roles we don't have. So like diabetes educator, there's government funding. But for cancer treatment, for example, it's private. So it's funded by private health insurance if they do something like that. Or sometimes it might be funded by or paid by the company, whichever company they work for. So it's erratic. It's variable. It depends on where you work. It's like a doctor who's a heart specialist, a cardiologist. They can be paid by government if they work in a government hospital, or they can be paid privately if they work for a private clinic.
So
or they can set up their own clinic.
So does it mean the pharmacist can charge for this professional services, right?
Yes. Yeah. For the more structured program, yes. But for a lot of these services, like I say, it's still very new. So we can't fight for funding before we have a role. So the first step is to create a role. Get pharmacists to work in the area and then fight for funding. Because without a role, you can't fight for funding. So the first step is fighting for roles. But it's an area that is growing, because the more specialization we have, the more job opportunities there are for pharmacists. Because otherwise, if pharmacists, when they graduate, if they can only go to community or hospital, they're fighting amongst themselves. But now, if there was specialization, there's more opportunities, there's more job opportunities, more career opportunities. So that's like why doctors specialize, because otherwise, if there's no specialization, they graduate medical degree, they become normal doctor. Everybody is normal doctor. How do they differentiate themselves? How do they get paid more? How do they specialize more? They need to specialize in different things. And that's what pharmacy profession is trying to do. We're still very early stage, but the list that I gave you, those are what we have at the moment. But we're still trying to grow specialization areas and different career paths for pharmacists.
Any questions, maybe? Any from the students?
Students, there are any questions? Okay, Kasim. To get their specialists, pharmacists get their specialists from formal education or by training?
Usually training. So they all have to have a pharmacy degree, and they all have to do internship, which is like your apothecary program. And then after that, they do special training. It could be for 6 months or 12 months. And so they would do special training after.
And automatically become a pharmacist after the training phase?
They would need to be a pharmacist already before they specialize.
Oh, yeah.
Mm-hmm. Like if let's say someone wants to specialize in mental health, because they're very passionate about mental health, they might do a counseling training course after that. They might do a psychology component after that. So it's like...
Sorry, Faye, how many hours does Australian pharmacy students need to do in their internship I mean, is there any equivalent hours? How many hours will then they get to become a pharmacist in Australia?
Yeah, so they need to do 1,865. I think the exact hours, I'm not sure, but it's just under 2,000 hours. So it's about 1 year full time.
Oh, wow, that's completely different with Indonesia. So you get to only spend a month, roughly a month in the community pharmacy, 2 months in the hospital. So that would equal less than 500 hours, maybe. So that's the differences. That's why there are so many specialized pharmacies. Maybe in Australia is starting to grow, but here maybe in Indonesia we do really need a, more extended hours for those pharmacy students so they can practice in a real practice environment, so they get to know how pharmacists do actually in the real life in helping those patients. So maybe students in pharmacy, in Department of Pharmacy, will know that there's a huge gap between how Australian pharmacy students and Indonesian pharmacy students do their courses in each. So one doing almost 2,000 hours and the other done in like less than 500 hours. So I think that with one of them will there's the differences in those. And I think we can also make an example of the Australian pharmacy students to later on we can create another curriculum for the students for their particular programs, so the students can, gain more internship, more hours in their internship, so they can become more qualified and more competent. So I think so. Hopefully, cross finger, we can do that in the next year.
So 2,000 hours is after the 4-year degree.
Yes.
Yeah, so
Correct.
they do 4 years degree for undergrads, and during those 4 years, they already do placement. So we already send them to pharmacy from year 1, in year 1, year 2, year 3, year 4, for a few hours, each week, kind of on average. And then after 4 years, when they graduate from Bachelor of Pharmacy, then they do the 1 year of internship, which is like your apothecary program. And then at the end of that 1 year of working, which is the 5th year, year 5, they then have to do 2 exams. One written and one oral. And then they become a registered pharmacist. And then after that, they will work as a pharmacist, they will practice as a pharmacist. And if they want to specialize, they have to do extra on top of that.
Wow, that's big effort to become a pharmacist in Australia.
It's very involved. And if you want to do a PhD, that's another 4 years on top of that.
I do think that taking PhD course is rather easier than taking a pharmacy internship. I mean, a year internship for 2,000 hours. Yeah.
Some of you guys, some of you all, as final year students, if you are thinking of your future, your career, you can obviously have a chat to your lecturers, to Iani and to Vinci, but Vinci will be able to guide you, I think, about life in a PhD and all that.
Life in Australia is pretty good, Faye, in this COVID-19. We are free from COVID-19 in Perth, Australia.
Okay, Dr. Sim, I think it's the same curriculum now in Indonesia. To become a pharmacist, the student must graduate in bachelor and then 1 year in a apothecary program. And now the Association of Pharmacy in Indonesia also plan a curriculum like in Australia. And we hope the curriculum can be applied as soon as possible in Indonesia. Okay, maybe student, there are any questions? Okay, Ratnadila, you can ask directly.
Yes, thank you, Mrs. Yani. My name is Ratnadila. Nice to meet you, Dr. Faye. My question is about the lecture the last week. It's about immunization. Is that okay?
Yes, yes.
Okay. The immunization, like pharmacists, like the immunization in Australia, is it covered by universal health insurance Australia or the private health insurance? And if not, how much does it cost to get a like immunization like that, like flu shot, like that? Thank you.
Very good question, Ratnadila, because so for flu shots, if I use influenza vaccine as an example, it depends on which part of Australia you are in, because we have different state governments. So if you are in Western Australia, which is where Vinci and we are in, as a pharmacist, if you give a flu injection to people between 10 years old and 65 years old, so if they're younger than 65, the patient has to pay for it. If they have private, so the government doesn't pay for it, but if they have private health insurance, the private health insurance will cover for it. So if they don't have private health insurance, it's about $19, $20, 20 Australian dollar for an injection. If they are 65 years old and above, so they're older, the government is trying to encourage older people to get vaccinated because they are at higher risk of complications if they do get influenza. So these people are covered under the government program, and the government will pay for it. So we get free vaccines from the government, and then we administer the vaccine to people 65 and above. Yes, it depends on where you are and in Australia and how old you are. Yeah. But otherwise, on average, it's about $20 per vaccine.
Yes, thank you very much.
No problem.
Okay, thank you very much for student and Dr. Sim. I think it's an interesting discussion, but time is up. And maybe before we end this session, we want to present a certificate of appreciation to Dr. Sim. Mr. Adib, please.
Oh, thank you. Thank you. That's a very nice surprise. Thank you. Thank you. I will thank you virtually online. Thank you. Thank you.
Okay. Thank you very much, Dr. Sim. Hope we can meet you again in other time or maybe another chance in Indonesia, I hope. And before this, we want to have a photo session.
Perhaps I will give some speech to Dr. Sim.
Okay, I'm sorry.
Hello?
Hello, Mr. Saptono.
Okay, good morning, Dr. Sim.
Good morning, Mr. Saptono.
Good morning, Dr. Sim.
Good morning, Mr. Saptono.
Okay, yeah. Okay. Yeah, I would like to extend my sincere gratitude and appreciation to you for accepting our invitation and also to give lecture on clinical pharmacy in 11 Maret University. And I'm very happy to have you during these last 2 weeks. Thank you so much for taking time your busy schedule to share your expertise to my students. I believe my student will gain valuable knowledge and also new insight in this topic. And again, my sincere thanks, and I hope we can continue this collaboration, and perhaps we can invite you again in the future. Thank you, Dr. Sim.
You're welcome, Mr. Saptono. Thank you for having me. I've enjoyed, being here and seeing you and your team, your staff and your students. Very happy to help. Yeah, thank you. Thank you for having me.
Okay, thank you, Mr. Saptono. And now we we'll have a photo session.
Okay, please turn on your camera or video. I will take a picture. Okay.
Hello, Pak Adi.
Please. Yes, Vinci.
How are you?
Okay, I'm fine. And you?
Good, thank you. So, Faye,
Okay.
this is Pak Adi is among four male staff in pharmacy department, if I'm correct. Am I correct, Pak
Yes.
Sabtono? So we only have 4 or 5 male staff in our department currently. So Pak Adi is one of the staff in here, Faye.
Yes. Okay, I will take a photo. Okay, please look at the webcam or your camera. 1, 2, 3. Okay, next page. Wait. Okay, 1, 2, 3. Okay, 1, 2, 3. And then last page. 1, 2, 3. Okay, finish.
Okay,
Okay,
thank
finish.
thank you very much, Mr. Ade and Dr. Sim for your knowledge and expertise to share with us. And students, now we should confident that we are medicine expertise, and we should struggle to fully utilize our skill for the patient center care. Maybe. Okay. This the end of the session. Thank you very much for Dr. Sim, and hope we can see you again next time. And
Thank you.
Okay. Thank you very
Thank you
much.
very much, Faye.
Thank you.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Waalaikumsalam.
Thank you.
Waalaikumsalam.
Thank you very much, Faye, for today and for us,
No
for your
problem.
assistance
Thank
and for
you.
your help as well. See you. Bye.
Thank you. Bye.
Have a good day.
Dr.
Bye.
Sim.
Okay, thank you
Yeah,
very
see you.
much. See you.
See you.
Have a good day, Faye.
You too. Bye-bye.
Bye-bye.
Ya, adik-adik bisa leave room dan ada
Ya.
kuis.
Terima kasih Bu Vinci ya sudah ikut bergabung.
Oh ya, jangan lupa untuk mengisi ini ya, daftar hadir. Silakan
Mohon
bisa
diingatkan
akses melalui
ya.
link tersebut.
Mohon diingatkan untuk teman-teman yang sudah live untuk diingatkan untuk mengisi formulir daftar hadir ya untuk kegiatan kuliah tamu hari ini. Kemudian bagi mahasiswa yang mengikuti kuliah farmasi klinik, jangan lupa setelah ini silakan diakses untuk sepada ada kuis ya dari materi hari. Terima kasih.